Hi, everyone. Thank you for making your way over to the Convention on Health Rights AB659 Emergency Update. Today, we will be going over some crucial updates for opposition. Please note that we will be sending out a copy of these presentation slides. Who we are. Convention on Health Rights is a consortium of organizations advocating for health rights. If you head on over to our website, you will find a full list of our incredible partners from local to statewide organizations. The organizations you will be hearing from today worked on the Convention on Health Rights letter and requests for amendments in the core AB659 letter. If your organization or group would like to be part of Convention on Health Rights, please reach out by visiting the website. I would also like to show you that there is a Convention on Health Rights, AB659 Cancer Prevention Act section right over here. This is where you can find the latest on AB659. And now we're going to talk about why we are here today.
Yes, the author has made it clear that this is a mandate without enforcement. But if the bill is not amended, there is a strong likelihood that it will be enforced. Previously, Karen and I had a discussion that we posted on our Convention on Health Rights website, where we spoke about the strong likelihood that even though this bill is currently a mandate without enforcement, that without amendments and adoption of the subsections that we're going to speak on today, there would be enforcement. We will be discussing in better detail shortly these subsections. Briefly, what we have a situation of is if you have a state policy that there is an expectation that pupils receive the HPV vaccine, the California Department of Education and/or the California Department of Public Health could issue guidance in the form of a facts section or a Q&A on their website. And based on this guidance, the California School Board Association could then put forward draft school board policies, sending these to school boards across the state who would adopt policies that have enforcement language in them.
And how to read a bill, and we've had a lot of questions on this. So if you go to Ledge Info and you look up this bill, AB659, first of all, I want to point out that it has been amended 4 different times. Karen, if you can scroll back up to the top, I want to point out that in the upper right-hand corner, there's it says version, and it will always default to the most current version of the bill, but you are able to pull down that menu and go to any version. So if you wanted to track along the way how it's been amended, you could do that. And the next thing that we want to talk about is the Legislative Digest. There has been some confusion about this. The Legislative Council's Digest is just a summary about existing laws pertinent to this bill, and then it will say this bill. So it'll say existing law does this, and then this bill would do this other thing. This part of the on Ledge Info, this part is not actual language. It's just a summary of what the bill is going to do. And then as you scroll down, you will see the actual bill language. The current amendments are additions are always in blue. Any section that's being deleted is crossed out and is in red, but you will only find the most current amendments that are in blue. So again, to see all that's been changed, you would have to go back through the different versions. And then we just want to briefly cover what's in this current version of AB659. So in section 4 and 6, it would make it the public policy of the state that pupils are expected to be fully immunized against human papillomavirus, HPV, before admission to or advancement to the 8th grade level of any private or public elementary, secondary school, and before first-time enrollment at an institution of the California State University, the University of California system, or the California Community Colleges. It also has added a notification section that says that just the notification has to conform to other notices that are provided by schools. So that will assure that these notices are translated into certain languages. The author has most recently exempted private homeschoolers, so that's here in the current version. And then it continues to expand insurance coverage for HPV vaccination and annual cervical cancer screening.
So the first thing we wanted to talk about was what our organizations, or the core Convention on Health Rights organizations, are requesting to have done to the bill in order for it to be a bill that we could live with. What we would really like is for those sections that Valerie just talked about, sections 4 and 6, that require this expectation and the notification to be removed completely. We don't think that's likely, and so we do have amendments that we're asking for if that isn't possible. But we would ultimately like those to be, if it was our bill, we would like those to be deleted. If it was our bill, we wouldn't have those sections, but we would like those to be completely deleted. As I said, we don't think that is possible, and so if we were to change the bill to make it with something we can live with, one of the key things that we are asking for is that the words expected are replaced throughout with either recommended or encouraged. And the reason for that is an expectation really is a mandate without enforcement. If I say to you, if you're expected to do something, it's kind of like, okay, well, what happens if I don't do it? I really should be doing this. If we use the word recommended, which is our preference, recommended, through COVID, we have seen the word recommended used a lot by the California Department of Public Health. Masks were recommended, vaccines were recommended, and people know that that does give them an option. So throughout the bill, we would like the words expected to be changed to recommended or encouraged.
Along with that, again, the authors made it clear that there's no enforcement for this expectation, but there's nothing in the bill language that would prevent it from being enforced by a school district, by guidance from the CDPH, what have you. So we would like to have sections added that specifically say that it does not prohibit a pupil who is not fully vaccinated against HPV from being admitted or advancing to the 8th grade level of any private or public elementary or secondary school, or from accessing in-person education, and as well to add a section that'll be on the next slide that's basically the same thing but applying to the college level.
There have been some other requests for amendments that we've seen from other organizations that are not a part of the Convention on Health Rights, and some of those we have concerns with. There's one amendment specifically which is asking, and that would give students access. So instead of expecting the student to get the vaccine, it actually states that it would give students access to the HPV vaccine and education on the HPV vaccine. And our concern there is, we understand that the organization thinks that would lessen the likelihood, it wouldn't force or make people think that the HPV vaccine is required. But our concern there is, over the past few years, student health centers have been funded more and more in California, and it is a growth, and many schools are trying to get student health centers onto their campuses. And so with that, we're worried that there would be HPV clinics in school. And with the passing of AB659 in 2011, 12-year-old minors and up can consent to the vaccine without their parents' permission. And so that's a concern for us, that if they do encourage the HPV vaccine in an amendment, that there would be vaccine clinics that would sort of open the door to vaccine clinics for HPV, and then those children to get it without their parents' consent. And so those organizations neglected to ask for further amendments that are necessary to ensure that there's no enforcement and that those minor pupils are protected.
We are asking to remove pupils from receiving notification. Currently in California law, there are requirements to send various notifications. These notifications are only sent to parents and guardians. There are no notification requirements in our law for pupils. You can refer to the California Department of Education Language Policy and Leadership for additional information. 48980 of the Education Code is the subsection referred to in the bill text, and it solely refers to parent and guardian notifications. Additionally, the bill as it is currently is does not exclude certain pupils from receiving this notification. Pupils on an IEP or a 504 plan would be included and receive notification. Pupils with cognitive or intellectual disabilities would be included and receive notification. The bill does not specify how pupils would receive notification. There could be notification by giving it directly to the pupil at school. There could be incentives propagandized at schools for pupils to get the HPV vaccine to receive items like food, electronics, and other prizes. Pharmaceutical companies could partner with school districts and provide financial resources. Schools could place pop-up health clinics on or near campus if they don't already have a health clinic. There could be peer pressure as well as coercive efforts that would greatly impact those who are vulnerable, including pupils living in poverty and those with exceptional needs. All of the arguments that we had with the SB 866, the minor consent bill, and the need for guardrails there are here as well. For these reasons, we are asking to remove pupils from receiving notifications.
So as we mentioned before, the current version of this bill does exempt home-based private school students, but it doesn't include many homeschoolers homeschool under the independent study program. And so we're asking that that be added, and this would bring it in line with other sections of vaccine law that exempt homeschoolers.
Yes, and similarly, one of the subsections that we're asking for is the addition to exempt pupils on an IEP to provide guardrails for pupils with exceptional needs. This would keep AB 659 consistent with section 120335 of the Health and Safety Code. While all pupils should not be subjected to a state policy with an expectation to receive the HPV vaccine, pupils on an IEP are most vulnerable to intimidation, coercion, and peer pressure. And for these reasons, we are asking for the addition to exempt pupils on an IEP in this subsection.
So what can you do? These are specific actions that you can take. We have 3 actions that we ask you to take. They're all slightly different. They have the same end effect, but slightly different routes and have bring slightly different priorities as we go through the bill. The bill is going to the Senate Health Committee next. It will be heard next Wednesday, June 28th at 1:30 in the Senate Health Committee. So the first thing that we ask you to do is to call each of the members of the Senate Health Committee, and their phone numbers are listed here. And what we ask you to do is just have a short, polite conversation with the person who picks up the phone. And we do have a sample script that you can use right here. You can say this exactly, or you can adapt it to yourself, but we do ask you to be polite, short, to the point, and ask them to vote no or abstain from voting on AB 659 unless it is amended. The second thing we ask you to do is to use this URL, this tiny URL, or the QR code, and that will take you to a link that you can easily complete, and it will email your senator, and it will also email the Senate Health Committee members. We do ask, if you do fill that out, to make sure that in the body of the email that you do put something that is personalized to you. Again, you want to stay polite and short so that they read it, but they also know that it is personalized and it's not just a robot sending them emails. And then the last thing that we ask you to do is to meet with your senator in your district. This is your local senator, not your your senator that goes to Washington, D.C., you can find your representative on this URL. And most legislatures are hosting events for the summer, especially during the summer recess. And that's approaching, that'll be mid-July to mid-August. And you really can take that opportunity to go to one of their in-district events. You can call them up, or you can get on their newsletter, and they usually have something about once a month where you can actually speak to them in person and bring your concerns to them. And it can be anything from a beach cleanup to a town hall meeting, to a coffee shop that they may be at. They may have various events, but definitely try to get to one of those, because you want to build that rapport with your legislators.
Thank you so much, everybody, for joining us today. Please ensure that you share this with all advocates in California that are for health rights. And please make sure that you stay connected with COHR by going to www.conventiononhealthrights.org to stay connected with each of the organizations that presented today on Instagram. Please follow A Voice for Choice Advocacy, California Health Coalition Advocacy, Educate, Advocate, and Stand Up California. Thank you again and have a great day.